Hi, everyone. This is Senator Samra Brouk, and I'm here today with Dr. Vivian Lewis in honor of Black Maternal Health Week. Dr. Lewis is a professor emerita at the Department of Obstetrics and Gynecology at the University of Rochester Medical Center. And we have her today as an expert in the field of reproductive endocrinology, infertility, menopause, in vitro fertilization, and hormone replacement therapy. And after a long career as a practitioner, Dr. Lewis now works at mentoring people of color and women who are entering the healthcare facility. So, oh crap. It's okay, she'll cut it. Thank you so much for joining us, Dr. Lewis. How are you?
I'm great, and thank you so much for having me. I think that it's so important to raise awareness about the importance of Black maternal health. People may not realize it, but maternal health is really a cornerstone to health overall, not just for Black people, but for everyone. You think about it, maternal health shapes the child's health, but also women tend to make decisions for their partners, for the entire family, about gets to have health care, what health care is needed, and what comes next. So really, this is a really, really important issue, and I'm so glad you're raising it.
Thank you. Thank you so much. And, I think there's so much that we can learn from people who have been on the front lines of this, right? You have seen the different parts of whether it's, before getting pregnant, during pregnancy, postpartum. And you said it so well that oftentimes the birthing parent or the mother in the situation is really kind of the hub with all the spokes, right? And can really make those decisions so that their increased health outcome is the increased health outcome of an entire family. So would you tell us a little bit about some of the work you've done and some of the work that you're doing and how that plays into, increasing these health outcomes for mothers?
Well, as you mentioned, part of it is the practice of medicine. So I practiced medicine with many years for the University of Rochester, and that was in the area of infertility, reproductive endocrinology, menopausal health. I also, because I was with the university, had and continue to have a role as an educator, educating medical students, residents, people going into obstetrics and gynecology primarily, but also some other specialties, and helping to work with faculty, helping them to understand what they needed to do in order to deliver excellent medical care and in order to help ensure that the next generation of students and trainees were well prepared to meet the needs of their patients.
That I really want to go deeper into that because I think you're not the first doctor to talk to me about this need to mentor future generations of providers. So can you share with us, we're sitting as part of Black Maternal Health Week. Earlier, I've shared stats with folks about the real discrepancy between health outcomes for Black mothers versus white mothers, even when you control for socioeconomic status, income, fame. You think Serena Williams and Beyonce, right? I mean, even they have had this trouble. So can you talk to us? I mean, you are now a mentor for future health providers. What are some of the things that you are mentoring them or training them on to be aware of to give the best care possible?
Mhm. So there's both providing care in a culturally sensitive way. There's also who else, because I'm at an academic medical center, who else are you welcoming into the field? Because we know that one of the ways that we can improve healthcare outcomes is to have a more diverse workforce, right? So you talked about some of the reasons that we have poor outcomes among Black women who give birth, Black people who give birth. And some of that is socioeconomics. Some of it is access to health care, social determinants of health, things like housing, education. Stress, though, stress is increasingly recognized as having a key influence over what kind of birth outcomes there will be, what kind of outcomes there will be for the mother. And that stress cuts across all income levels and all education levels for Black women in particular. So you can be Serena Williams and also experience stress and bias and discrimination because of your race. And so some of the work that I do now in terms of mentoring people is to help them understand the importance of recognizing their own biases and doing something about it, improving their communication style, taking the time to listen respectfully to their patients, making sure that their office staff and office environment is welcoming to all kinds of people and that people are shown respect, getting feedback from patients. I used to run an office for people with infertility and reproductive problems. And this was kind of before so much of an era of rate your doctor online, but we would hold educational groups in the evening. We would have forms for people to anonymously even make out if they felt that people weren't being respectful to them. We had all staff meetings, listen to what the nurses observe, what the front office observe. Everyone has something to contribute about the patient experience, and everyone's voice should be listened to and respected. So a lot of that is to circle back and summarize, your communication style is really important. It really governs whether a patient's concerns are being met, whether they feel comfortable voicing those concerns, how they're going to get health information. People talk about conspiracy theories that are out there about health as well as about other factors in our society. But that's because people are just seeking knowledge from somebody they trust. So if you can't build that trust with your patient, then you're not going to be a good doctor for them.
Wow. That is just so well put, the building of trust. Because you can't ever have a very siloed conversation, because this conversation could be about COVID vaccine. This conversation could be about who got COVID-19 and who didn't and who had worse outcomes. I mean, all of this is intertwined, right, with history in this country, and also the healthcare system. So, I mean, I think you just gave a prescription as a doctor. You gave a prescription to providers who know that this is a problem and they want to do better for their patients. You also touched on some things about this feedback loop, that you were the first version of Rate Your Doctor or ZocDoc or wherever you get to go. And I'll share, as a Black woman in my 30s, I'm out there, looking for providers, and I'm looking all over online to see, how do they treat people? What are their outcomes? Word of mouth ends up being so important, for someone who had a good experience. So on that note, what do you think some of the things that Black women or pregnant Black people can do to advocate for themselves, or how maybe some of their loved ones might be able to do it from their perspective?
Mm-hmm, mm-hmm. So I think that first of all, don't be afraid to ask questions. And if you feel like you're not getting an answer or answers that make you feel respected, then kind of vote with your feet. In this day and age, most people have choices about where they're going to go for their health care. Hospitals and health systems are rated on their patient experience. So people really are beginning to pay attention to that. So if you have a bad experience, don't be afraid to speak up. And also think about it's the doctor, but it's also other people in the healthcare system who can help advocate for you. Nurses, office staff, pharmacists, all of these folks, physician assistants, make up the healthcare team and really have an important role in your experience and what kind of health outcome you're going to have.
So you think, even beyond making the relationship with your doctor per se, but really kind of taking the time to build a relationship with office staff, with the nurse or the nurse practitioner or the physician assistant. I mean, for someone who maybe this might be a little scarier and they're not used to, really speaking out, maybe would it be helpful even if you built a rapport with like the administrator who's booking the appointment, someone who
Yeah,
knows
for
you
sure.
or knows about you?
Yeah, for sure. For sure. Very much. Very helpful. And I think about it, they're the ones who can often go behind the back door and say, wait a second, this person really, I think they really need to move up in the appointment schedule. They can talk to the nurse, they can get their attention. Even in the virtual world, this still happens.
Yeah. And it's speaking of the back door or the side door, right? We're talking about, it's not always on an individual basis that these, discriminatory practices or the bias happens. I mean, these are all systemic too. And so, when we're talking about Black women coming through this healthcare system or Black pregnant people coming through the healthcare system, much of it perhaps was not created with us in mind. And so sometimes we have to do things in a different way. So I like that you called it the back door or the side door to say, however we can get that advocacy, let's go after it.
Yeah.
And
Yeah.
if it means, I have to say, I was recently, I'll share with everyone, I was recently making an appointment with a new provider.
Yeah.
And I was just talking up the woman on the line that gave, that was making the appointments.
Yeah.
And I called her now 4 times and she remembered me. And I, shared parts of my story of why I needed and what was
Yeah.
necessary. And I was happy, actually, in honor of Black Maternal Health Week. My first appointment is on Wednesday, which was very
There you
exciting. And
go.
I said, I'd really like to meet the doctor first. Can I do it over the computer? That's important to me before I come in. And she was able to help me navigate that. So for anyone who's listening, that's a true example of talk everyone up. Share your story. Yeah. So that I'm glad, this is part of it. It's like when you talk to people who have done this work and you see the other side of it, right? I'm sure you've been approached by a receptionist or someone who has told you, hey, Dr. Lewis, like this person needs this, or did she mention this to you, So that's helpful. I want to jump into, because I could go through that all day, but you have so many specialties. I want everyone to be able to absorb some of the amazingness that you've got. So, another thing I want to talk about that I think is hard for a lot of people to talk about is infertility. And one of the things I've noticed as all of my friends are starting to have children or try to have children is that infertility is much more prevalent than I think a lot of people realize. And one thing I recently read from the CDC was that Black women are twice as likely as white women to suffer from infertility. So I know that's probably not new for you because you've been in this work, but do you have any general advice maybe that you've given to your patients or to couples or people who are struggling with this right now and something that, might be helpful for them to hear?
I think the most important thing for people to hear, is not so much for people who are already patients, it's for people who are delaying becoming patients. It's lessening, but I still think there's some stigma and embarrassment attached to, quotes, admitting that this is a problem. It's almost like mental health in that way. I've had people come to me and say, I confided in my minister, and the next thing you know, he was having the whole congregation pray for me. I didn't want that out there, and people asking all kinds of personal questions about me and my husband. So for understandable reasons, sometimes understandable reasons, it can be embarrassing and people can feel like there's a stigma attached. As I said, I think much of that is changing. And so I think if you think you might have a problem or you're even considering getting pregnant, especially if you're a little older, talk to your healthcare provider. And that honestly can go for men as well, because people forget that men are part of the equation, even if you're a same-sex female couple, that your partner's health matters too. So don't delay seeking help, because that can only make it harder for you to get treated. Pay attention to your overall health. You're both more likely to have a pregnancy and be a healthy pregnant person with a healthy outcome if you're in good health starting out. Black women have historically, or partly for probably sociologic reasons, had some particular risk factors like income or insurance status may have had a greater likelihood of infertility, but also some general health issues that are more common. High blood pressure, obesity, uterine fibroids. Those are conditions that don't preclude people getting pregnant, but they can make it more challenging to have a healthy pregnancy. So being sure that you are doing what you can to optimize your overall health is a very good idea as well going into it.
That's really helpful. And I know I certainly, I'm not a mother of anyone other than a puppy right now, but I know that just even as a woman, any excuse to remind us that taking care of ourselves is taking care of a future family, is taking care of our current family, because I feel we're oftentimes prone to kind of putting ourselves last, right? And to hear you say, your health is what matters most, and being able to keep these things in mind, if not for yourself, perhaps for your family, you do it. And I know sometimes that resonates with us more, right? If we know that we're helping others.
It is amazing, yes, that you have to rationalize it. I'm doing this for someone else, not just ourselves. It's a very interesting thing that I've observed about women not only trying to get pregnant, but also in professions so often as well.
Yeah, these are just good life lessons, outside of even just Black maternal health. These are all good life lessons, I think. So the last thing I wanted to cover, and I'm hoping you'll continue to give these gems for people to take home, is the other side of this. So there's infertility and pre-pregnancy, but also there is menopause. And I'm purposely ending with this and bringing this up because I was just on a call earlier this week talking about aging, and the fact that we don't think about aging as something that we need to solve and deal with, whereas we'll all be so lucky to age, right? Is that not the goal, is to age long enough to go through menopause, right? Versus the alternative. And so let's talk about it more, right? Let's talk about what there is to expect. And so I know that you've done some work with that as well. Is there anything, we know the discrepancies in Black maternal health. Are there discrepancies that we should be aware of for Black women or Black people who go through menopause?
Yes, there are some important differences. And as you say, it's a physiological event. It's natural. It's something and people spend maybe a third of their life, as much as a third of their life, after menopause. So it's not something to be feared or looked down upon, but in our society, aging can have that negative connotation. So yes, the actual time of entering menopause, a couple of years leading up to it, there are some reproductive kinds of experiences that women can have that are not always welcome in the way of symptoms of menopause, symptoms of perimenopause, the time leading up to it. And for Black women, some have observed that these can be more severe. And so I think that people need to, again, be mindful of the need to take care of themselves, be mindful of the resources that are available to proactively seek health care that would help them navigate this time period and lessen the symptoms and think about the light on the other end of the tunnel when it's all behind you. Because for most people, the symptomatic part is fairly brief.
I see. That's helpful. And I think one thing maybe someone else might be wondering too, when you're talking about, go to your healthcare provider, is that in terms of menopause, is that primarily still an OBGYN that you're going to, or is a primary care physician or nurse practitioner also?
A lot of primary care physicians are well qualified to provide certain aspects of reproductive health. And so, in choosing a primary care physician, women might be mindful of whether they need that or not. OBGYN physicians are certainly specialized in this area of medicine. But there are typically nowadays a lot of physician's assistants, nurse practitioners, certified nurse midwives also provide care in all of those areas. And so I'd encourage, and family doctors as well can often provide a pretty full scope of health care to support Black women's health in general, and do a good job of helping us as a society address Black maternal health. I guess one other kind of quick caveat that I would add, since you are a legislator, is that I think it's really important for all of us to advocate with our elected officials at all levels to be sure that this part of healthcare is well supported. We didn't touch on this, but I do think that there are often gendered aspects of healthcare coverage that do not act in the favor of women. They're discriminatory, and I think that that's important in terms of reproductive justice. And in terms of ultimately Black maternal outcome, I think that as much as we have tried to expand, and we have, especially in New York, expanded access to care for infertility and maternal benefits in some locales that can be tiered, such that people are they don't have as many options if they are, say, on Medicaid or on Medicare. And I think that that's something that needs to change. And to the extent that it's possible, I hope that there are legislative remedies that can be applied.
I am with you 100% on that. It's certainly something that, sitting on, you get to sit on these committees in the Senate, and I am lucky to be on ones of just all my passions. So I'm on women's issues and we talk about these things. I'm on the health committee where we talk about these things. Obviously, I chair the mental health committee, which is it's a whole other week
Outstanding.
or
Yes.
a year.
Yeah, no, that's outstanding.
That we'll talk about. But no, I mean, you're absolutely right. I think that, we've all witnessed it too, right? It took until the Affordable Care Act to even consider going to an OBGYN, and it's Black Maternal Health Week, so I'm going to say it, and get a pap smear,
Yes.
To even consider that as primary care, when it is the most primary care for a person with a uterus who needs this care, right?
Yes, yes,
and
yes.
So
yes.
we had to legislate that, so we can't be afraid, if,
Yes.
in terms of reproductive rights and having access to healthcare. So certainly this is the official, I'm saying it out in public, the open door. The door is open. If you have ideas from your work or, from some of the mentorship you're doing of where you think legislation can help, certainly that is something that I would certainly champion in addition to what we've already done. But I think that you just bring up so many good points. And I think, I want to, and I'm sure you would agree, part of this week was also about naming these disparities and bringing awareness, because something I've noticed among my own circles is there are women and pregnant people going through this and they think it's them, or they just think,
Yeah.
they don't know why they feel like they're not being heard, or why they say they're in pain, and people don't seem to react. And I think it's important, and you're hearing it here from a provider herself here, Dr. Lewis, that this is a big problem. And it's not just one individual woman or person, or even one individual provider. Usually there are just so many systems at play that are creating these disparities, but that there's also tools and resources. And so,
Yes. Yes.
I know you're not practicing, so we can't send anyone to go, because you would be
No.
amazing, but
Thank you.
but it's good knowledge. Yeah.
Well, so I will bring up then one other thing that I think the legislature needs to pay attention to, and that is that New York has such a world-class system of medical education. We have so many medical schools in our state, and how many healthcare providers do we educate who are African American, who are Latinx? Because these things also play a role in the patient experience and patient outcomes. So you talk about bias in healthcare. Obviously, everybody has to address that, all practitioners. And yet we know that if you have a practitioner who looks like you, just statistically, you're more likely to have a good outcome. We also know that Black and Latinx providers are more likely to go into communities of color where there is just a real dearth and crying need for more practitioners. So we educate so many practitioners. What can we do to keep them in state? What can we do to have a robust pipeline of Black and Latinx children growing up who want to go into healthcare, who want to stay in New York, especially Rochester, New York, but stay in New York and provide the best possible care for all our citizens. It's so important.
Yes, that's all I have to say. Listen to this doctor; she's right. In the state budget, we fought. They did try to take away the funding for a lot of this diversity in medicine program. We were able to fight to keep some of it, but we know it's only part of the solution, right? Because we also have to make it a habitable environment for people to want to stay in these programs. So let's end with some action items that we can give people. So, Dr. Lewis, I wrote some of these down because they were good, talked about building trust with your providers and use the side door. If you don't feel you could do that directly, or it's intimidating to do that with the doctor, can you do it with the nurse who does your intake, who's weighing you and, does all of that, you checking your oxygen levels and all that? Or can you do it with the receptionist? Is there anybody, in that world that you could build that trust and relationship with? And I love what you said, don't be afraid to ask questions. Sometimes it's uncomfortable. Someone answers you and you think, that should be the answer. But if you don't feel like you got the answer, you stay. Right?
Exactly.
Sit on that table until you get the answers that you need. I think that those are fantastic. Are there any other resources that you would point folks, especially here in the Rochester area, that you think that they should go to look for any of this information, or providers?
Yeah. I think that Rochester is fortunate to have some wonderful community resources. There's certainly the Healthy Baby Network for people who want to become pregnant, and they have information, they have support groups, they have lists of providers. So that's a good resource. Black Physicians Network, they have lists of providers who are African American. The Common Ground Health can be a good health resource. Health information resource. And finally, there's lots of national organizations, but locally there's a chapter of the National Black Nurses Organization that's quite robust and very active. So those are some local groups that I know that are very active and trustable resources of information and networking.
Beautiful. And we will share all of those links with folks to make sure we get that information. Dr. Vivian Lewis, thank you so much for doing this with us. Thank you so much for the work you do in our community. I hope that this is just the start of, this is the awareness building. It's getting information in the hands of people who need it in new ways through social media, right? Through email, through Zooms, and it's important to have all this information out there. It is free, it's accessible. So we just I'm so appreciative that you spent this time with us. And for anyone listening who heard something that resonated, take it and run with it. Use the side door, build the trust, ask your questions, because healthcare has to work for us. And my promise to you all listening, including you, Dr. Lewis, is that I will continue the fight in my role as well. And so that open door that I open to the doctor is open to anyone. Give us your ideas, give us your concerns. That's where good policy making comes from, is when it's creating solutions to problems that folks are facing. So thank you all, and we will see you again for more for Black Maternal Health Week. Don't forget to follow at Senator Brouk, where you can get all these resources.
It's been an honor, and thank you for all you do.
Thanks, Dr. Lewis.